So as a rural provider, I practice in a town that's surrounded by a number of larger communities, and as a result I have patients who go to multiple different hospitals for their care. It can be a big challenge to get results of hospitalizations and testing and labs and x-rays that they get at these various other institutions. And that is something that interrupts the flow of the day, makes it more difficult to provide the best care for somebody who's seeing me after they've had care at another site. HIXNY has helped me to access clinical information from these various hospitals so that I can see, for instance, lab results on somebody who was seen in the emergency room the day before. And some of the things I've found the most helpful have been culture results and radiology reports that typically would take our staff quite a bit of time to track down, and in the context of a busy day, it can really interrupt the care. And so I'm often having to, prior to HIXNY, I was having to provide care with less information than optimal, and now I feel like I'm able to know that I have the clinical information to respond to their needs.
I have been using the HIXNY portal in my office in conjunction with my electronic medical record. We have finding it to be a tremendous resource not to be able to get the information that is necessary to take care of patients. Not having to go to individual hospitals and laboratories to look up the information is a tremendous time saver for us, and expedites the ability both to take care of patients and to avoid redundancy in ordering tests, x-rays, etc.
As an example, just yesterday I spoke to a patient on the phone who had been admitted to a hospital for an infection, and upon discharge she was very unclear as to why she was being treated with the antibiotics, and I was able, while I was on the phone with her, to be on the portal, going over her results with her in real time. And in contrast, in the past, I would have had to call her back at a later time, and we would have had to track down that information, taking a lot of time, and making both of our days a lot more complicated. And being able to speak with her on the phone, and as she mentions a specific test, I'm able to look at that test and go over that test with her, was incredibly efficient, and was allowed me to help her to understand her care, which is important for safety and for her health.
I think the promise of HIXNY is the ability to integrate various electronic medical records that individual practices are setting up but are not necessarily talking to each other. And this allows for information to be exchanged directly through clinical care documents. By doing this, it would update the individual electronic medical records from information that's already been obtained by other practices, saving time, and more importantly, disseminating information from one practice to another, from a family practice or a primary care doctor to a specialist, to provide better, more comprehensive care without being redundant or delaying the diagnosis because of lack of information.